Action. Hi, how are you today? Good. All right. So I was looking over your chart and I saw that you have a goal of improving your range of motion in your low back. So that's what I'm here for, and we're gonna try to improve that today. Okay. So the first modality we're gonna use is called lumbar traction. Lumbar traction is going to help alleviate some of that bulging disc I saw in your past medical history. It's gonna alleviate some of that pressure and the pressure in your disc. So it should help alleviate some of your pain that you're having. By alleviating some of your pain in that low back and by reducing that compression should improve your active range of motion, because lessening your pain should help you be less stiff and overall just help you move more freely, therefore increasing your range of motion, okay? So bringing it back to your functional deficit of decreased range of motion, I know you're not able to move that freely right now, being all that stiff and everything. So overall, this should help increase that range of motion by alleviating some of that so much pressure that you have in there, okay? So the expected outcome is just to have that decreased pain. I know you have a 9 out of 10 pain, which is very significant. And so reducing that will help, reducing that joint space, increasing that joint space as well, will help alleviate that pain, therefore increasing your range of motion, okay? So that's the first modality we're gonna use. And the second one we're gonna use is we're gonna be using a therapeutic massage, okay? So I'm gonna be using a technique called trigger point release. And to warm you up, we're gonna be using effleurage. So effleurage is just to get you used to the touch, and so I can spread that lubricant over your back so I can get that nice little trigger point release. So using that trigger point release will help alleviate some of that contraction, the contracted muscle in your back, which will help relieve that pain and overall let you be less stiff, okay? So being alleviating some of that trigger point release should, in the long run, should help you be less stiff and have that more range of motion because of the less pain you're having. Okay, so I know the goal of this treatment overall is just to improve that range of motion in that lumbar area. So getting that trigger point release and should help it. So the plan is to effleurage you so I can get you warmed up nicely, and then I'll palpate around, find some trigger points. Trigger point release it for about 20 to 60 seconds is roughly how long it lasts for that, or until I feel it release. And when it releases, you should have some of that decreased pain. During the trigger point release, it shouldn't be too comfortable. You should actually have that slight discomfort while I'm doing it. However, this is normal. After it happens, you should have that relief and have that increased range of motion, okay? Do you have any questions currently? Okay, sounds good. Sounds good.